97% of healthcare data that is collected is never used again. So nobody was aware of that because I was off the board, basically doing all this behind the scenes, and it almost killed me. And I passionately believe if you get that right, it works like a dream. You know, iaptus takes on more than 1 million new patients every year, and we're now over 10 million patients in our database. That's a fifth of the population. They all looked at me and thought, wow, that is really smart, and why haven't we thought of that? We've done that from day one, and it has been transforming.
Welcome back, everyone. Today I'm joined by Chris May. He's the founder of Mayden. Mayden is a very successful company that operates in healthcare, and it's been going for 25 years. Chris May is one of the kindest person I've ever met, and he's one of the most humble people as well. And obviously I work for Mayden, but also everyone I've talked with has said the same thing: humble and kind. Chris, thank you for joining me today.
Thank you. That's an introduction I wasn't expecting.
Well, it's true, isn't it? Like 25 years and everyone keeps saying the same thing.
Which is great, yeah. Yeah, I didn't pay them either, so yeah.
Yeah. So I've got loads of questions for you today.
Okay.
And they have to do with Mayden, they have to do with you, and they also have to do with some of the things you're working on.
Yep.
So at the very beginning, I just want to focus on Mayden.
Sure.
So I would like us to start by going into the story of Mayden, how it all began, how you built it out, and just start there, if that's okay with you.
Sure, absolutely. So, I mean, it depends how far you want to go back, because
as far as possible and with as much detail.
Okay, so I trained as an engineer, so at university, and I did postgrad at Cambridge in manufacturing management. And my first job out of university paying tax was working for Cadbury's, and I was designing and basically constructing production lines and automating them. So Cadbury's was very much a manual operation when I joined, and they were slowly automating and computerizing everything. So just to give you one example, they made me production manager of cream eggs, and where I was managing 50 people on a production line. And then, because I was an engineer and that posting was only a temporary thing to get me used to the production environment, they then wanted to create a new plant making cream eggs that didn't employ so many people and automate as much as possible. So I kind of got used to the operation, and then I was on the project team to rebuild the cream egg plant. And when we built it, we ended up having a production line that only had 20 people on. So we managed to replace 30 people with machines. And and I did that for a few years on various plants. So I moved around the whole kind of the Cadbury's range. You know, I love chocolate, by the way.
That's one thing everyone says.
Yeah.
It's also because you love chocolate.
It's really strange. I broke the mold, because when people join Cadbury's, after 2 weeks they hate chocolate, because you're allowed to eat as much as you want when you're there. And after 2 weeks, nobody can stand the sight of the stuff. It didn't happen to me. I just kind of carried on eating it, and still do to this day. I don't eat as much as people think I do, but it's a bit of a standing joke, I know.
So you say you broke the...
Broke the mold, as in as an employee, I was the employee that never got sick of eating the chocolate.
Is that because I was talking with Dave Rogers, and Dave was telling me about, obviously, the Cadbury thing. And he also asked me to ask you about a funny story you have there. Is that the funny story with...
No. There's I don't know. I think I know which story he's referring to. So there was... I was working on something called the number 13 plant. And this was a plant that did the 1 kilogram Cadbury's dairy milk bars. And it was the production line was spread over 2 floors. And we shut the plant down for a day to do a whole load of testing and checking and maintenance and all sorts of stuff. And I was working on the lower floor and basically trying to get something called the tempering process correct. And fun fact, to get chocolate the way it is and with the nice snap and crisp that that chocolate has, you have to temper it. So it starts off in liquid form, and then you cool it down to solid form, but it's not a straight line. You cool it down, then you heat it up, and then you cool it down, then you heat it up and you cool it down. And that's called tempering. And what happens is that that tempering process creates a crystalline structure which makes the perfect chocolate. You can do that in any number of ways, and there's about 64, I think, different crystalline structures that chocolate can take. So if you ever melted chocolate and then basically set it again, it's never quite the same afterwards because it's not been tempered. It's kind of just been melted and then cooled. Anyway, I was messing around with this tempering process and trying to get the control systems to just be absolutely perfect. And I was pumping chocolate around the ring main. And what happens is upstairs on the upper floor, chocolate would just get pumped around these pipes. And then when the production line called for it, a valve would open and put chocolate into this big storage tank, which would then deliver it to the production line. What I didn't know was that I did know there was a guy working on one of the storage tanks up there. He was taking it all apart because the propeller wasn't working and stuff, and he was maintaining it. What I didn't know was that to get the lid off this storage tank, he'd actually remove a section of the pipe. So I was pumping chocolate around this. I pressed a button. Suddenly there's all this screaming and shouting from upstairs. And I basically hit the emergency stop button. I basically ran upstairs, and this engineer who was at the bottom of the storage tank with all of his tools laid out was covered in 0.7 tons of liquid chocolate. And yes, I mean, it's funny when you talk about it now, but I was mortified. And it actually wasn't my I mean, he should not have taken off that section of pipe. And if he had, he should have alerted people. But unfortunately,
It's funny.
So, and that all had to be thrown away, unfortunately,
Oh.
which is a lot. I don't think I've eaten 0.7 tons of chocolate since, just to put it in context of how much was actually destroyed.
Wow.
But, yeah.
So he was covered in chocolate.
Yeah, he was covered in chocolate and all his tools, and yeah, it was a mess, basically.
Did he try to lick himself? Like,
I mean, he was wearing brown overalls, so and so yeah. But he was a tiny guy. He was only about 5'2" or something like that. So
okay.
yeah, so he was definitely he's probably one of the few people in the world that can claim to have been, sort of almost drowned in chocolate. But yeah, so yeah, that's the funny story, but not so funny on the day that it happened.
I see. So Cadbury, working there.
Yeah, so then I went back to Cambridge, and I was actually on the staff for a while. And I was doing lots of projects in industry, and ended up working in, not me, I ended up having some students doing a project in the hospital. I was also being put under pressure to do research because universities are measured by their research output. And I was doing lots of consultancy and lots of teaching and managing this course. But I wasn't doing research, and they wanted me to add research to my portfolio.
University of Cambridge?
Yes.
Okay, cool.
And so I decided, in my wisdom, to do a project comparing manufacturing systems and systems in healthcare, to see if either could learn from the other. I was an expert on manufacturing systems at this point, so not an expert on healthcare at all. So I had these two students working in a hospital outside Cambridge, and the chief executive at the time, I asked him if I could use the hospital's information systems and just have not access to the patient data, but to just understand how the systems work, whether I could use that hospital as my kind of base for doing this research. And he basically says yes, in exchange for free consultancy, because we know we're a bit behind where we should be in terms of IT. So if you give us advice, we'll let you use our systems for your research purposes. So we did the deal. The student project finished, the students left. I carried on doing the consultancy and my research. And after a couple of months, I realised that the manufacturing had nothing to learn from the health service. The health sector was so far behind in IT compared with manufacturing that, my research wasn't going to go anywhere because it was all one-way traffic in terms of, sort of translating good practice. But at the same time, the chief executive took me to one side one day after a conference. We went for a drink and basically offered me a seat on the board of the hospital. And, and basically said he wanted to, really enhance the IT of the hospital. And he wanted me to sort of help him do it. So by this time, I was really excited by the prospect of transforming this hospital. I mean, it ran on 2 Amstrad PCs, and there probably won't be many of your viewers that know what they are because but yeah, they were a very popular sort of PC when PCs first came out because they were really cheap. So I basically left the university, jumped ship, and went to work in a hospital. And in 3 years, completely transformed the place in terms of IT on a shoestring budget. But the main thing that I think the main contribution I made was I started producing data and information like they'd never seen before, just from the data. And the hospital had entered a pilot for something called the internal market, where you saw health services trading with each other and actually charging each other for different services. And the GPs that referred to this hospital were so pleased with the information they were suddenly getting out of the hospital, because it was like nothing they've ever seen before. They started referring more patients to the hospital, and the money came with the patients. And so suddenly the income of this hospital was just started to balloon. It started to, go up rapidly. And that was all because of information. So I was already kind of at this point realizing that, information was a really important commodity and something to be sort of traded. I then got headhunted by a new consultancy company just outside Bath. And I was the number 4 employee, so there were 3 people there already. They were all ex-Price Waterhouse consultants who had set up this boutique healthcare consultancy. I was number 4 to join them, and I was basically there to bring that technical side and data analytics side to their practice. And I was there for 6 years. We helped build up the practice from the 4 people that were when I started to about 34 when I left. And what I realised over that 6 years, I did loads and loads of different projects, but what I realised that the health service was sitting on a mountain of data that it wasn't using. And so when I left the company and decided to set up on my own, Mayden was originally envisaged as a boutique healthcare analytics agency. I kind of thought my dream was to employ about 12 people, all analysts, and we were going to basically take all of this data and we were going to turn it into gold. And that's basically was the birth of Mayden. Really was the recognition that this data was really valuable and just not being used. And it has since been estimated that 97% of healthcare data that is collected is never used again, which is a staggering amount given the value that it could have if only we used it properly.
And that report was true back then?
No, that report was a recent one. So
yeah,
it's only 2 or 3 years old, that particular one. I first heard it cited at a seminar that Amazon was giving, but I've since seen it in articles by Google. And so everyone's picked up on this research paper. Can't remember the author now, but I can believe the stats. And because we're now in an era of, where data is a new oil, and we've got AI, which is able to crunch data like we've never seen it before. People are starting to wake up to this fact that there's actually massive untapped potential in the data that's in health systems.
So let's go back to the boutique. Before you actually went to set up on your own, you were working with, you left the hospital.
Yeah.
You went for a consultancy.
Yep.
And you worked there for about 6 years.
Yep.
And you realized you were sitting, well, not you,
the health
country
service
was sitting on loads and loads of information in healthcare.
And the world, as it turns out.
And the world, yeah. So I guess one thing I'm curious about there is, what made you want to leave a salary and set up on your own? Is that because you said you always wanted to have 12 people maybe employed? Like, is that was that like a realization in the moment, or have you always had that?
No, I mean, I've been self-employed before. So when I left the hospital, actually, I was self-employed for a while. So I didn't go straight from hospital to consultancy practice. So I wasn't scared of it, because actually it was more terrifying the first time. The second time I had a much bigger network in the health sector, so I wasn't too worried about it. But actually the reason that I left at the time I did was because my wife became very ill, and things at home were really difficult. And consultancy is not a great career to be in in those circumstances, because you're literally up at 5 a.m. and you're driving hours to go and spend the day on a client site, and then you're getting back after the kids have gone to bed. And so that was the main reason I left at that particular time and decided to set up. But I was quite clear about what I was going to do. One, I wanted something where I could work from home a bit more initially. And initially it was just me. I was working for myself, self-employed. And then things got easier at home, and decided actually I wanted to build something, and not just, there's I mean, we would eventually come onto it, but we might as well deal with it now. The agencies basically turn time into money. So you do particular projects, and you work out how much time is going to be involved to deliver whatever it is, and you basically charge an hourly rate and get fees. That's not scalable without employing loads of people who are also doing the same thing. And I wanted really to create some sort of product which was much more scalable than just me translating my hours into money. So that didn't come until a few years later, but that was definitely a very specific thought I had. That, yeah.
So going back to the boutique, so you had the idea, you wanted to leave, you eventually left. Let's talk about, walk me through what happened next. How did Mayden become Mayden? How did we get into iaptus?
So an iaptus obviously being the biggest product, which is a patient management system for psychological therapies. But that didn't come along until we were 6 years into company. So what we were doing for 6 years, I was doing a lot of consultancy still. So I carried on doing what I was good at and what I knew with the people that I knew. I had a reputation and a kind of a network. So it wasn't difficult to find work initially. And at the same time, I started building some stuff with a developer. But the first major project that Mayden got into was actually not in mental health at all, but in cancer. So at the time, and we're talking about the year 2000, that's when Mayden was formed, a report came out which highlighted the postcode discrepancy in cancer care. So the quality of care you got if you got cancer was vastly different depending on where you lived in the country, which is obviously totally unacceptable for a national health service. So NHS, the Department of Health, turned into NHS England, but that sort of overall body formed something called the National Cancer Action Team, and its job was to basically get rid of this postcode lottery and improve the quality of cancer care. And we ended up doing all the digital work for it. But it started out from a consultancy project. So I was working in doing consultancy in North London. One day I came into the office that I was using, and my desk was piled high with paper. And I kind of said, "What's that?" And they said, "Oh, we've just done a self-assessment. This is all the paperwork from all the hospitals in North London. And it's kind of, they've been filling it out. And it's every single cancer service in every hospital. So you've got breast cancer, colorectal cancer, lung cancer, etc. Across all of the hospitals. I want you to analyse this mountain of paperwork and give me a report in a week's time." And so I started going through the paperwork, and what I realised was it had all these standards in that you should be meeting if you were delivering a good breast cancer service or a good colorectal cancer service. And the hospitals just had to say, were they meeting that standard or not, yes or no. So it was a big self-assessment exercise. And I thought, you're not going to pay me as a consultant to literally just count yeses and nos. That is like not a good use of money. So I took the entire pile of paper back to home, which was in Wiltshire. Got a friend who'd just gone self-employed to basically database it all, bang it all into a spreadsheet, which she did in a couple of days because she was very fast at that sort of data entry sort of thing. And then I created a database which analysed the data and basically produced this report, and it could cut it by hospital or by cancer. So I could say, it could pull out lung cancer and show the performance of all the hospitals across North London, or it could pull out hospital and show all the cancer services in that hospital. And so when I produced this report a week later, it was all kind of analyses coming out of this database. We sent it off to the NHS regional office in London, and they got this report from North London, which was all kind of very professional with all of these tables and charts and graphs. And I don't know what they got from the other cancer networks, but I think it was all like manually written or something. And they went, wow, this is amazing. And they asked me if I would do the database for all the cancer services in London. Then South West England got wind that this database existed, so we ended up doing it for whole South West London. And then South East England also wanted me to do it. And at that point, I said no, because this wasn't on the internet. This was an access database, so it was all on floppy disks. And I said, no, there's an internet now. And I know you don't like it, NHS, because you haven't really engaged with it. And we've just had the .com crash, so the NHS was kind of very fearful of the internet. But I said, this is how it should be. We should be doing this on the internet. So we managed to persuade the Department of Health to part with some funding and run some pilots, both in the north of the country. And we built a database online. This very system did exactly the same thing. But people can now do their self-assessments online rather than on paper. And then, we wrote the reports to analyse it. And rather than taking 6 months for the Department of Health to take all this paperwork and crunch all the numbers and add it all up and produce a report, which is what they plan to do, I basically said, we can do this in seconds. Literally, you tell us what the report needs to look like, we'll design it, and at a touch of a button, you can get the state of the country literally in that moment. So they did 2 pilots that were hugely successful. Everybody involved said, yes, we should definitely roll this out across the country. And then we ended up basically doing the entire country. And in fact, that system didn't really stop until 2013 and wasn't shut down until 2019. So, and I think at the time it was shut down, it was the longest running website in the NHS at that time. And of course, most people in Mayden weren't really aware of it, particularly in that last decade, because by that time, we were into mental health big time, and that was the main focus. But yeah, we, from about 2003 through to the end of that decade, it was actually Mayden's biggest project. And it is something I'm really proud of, because we can say, we solved the postcode lottery in cancer care. And I'm very sad to hear on the news yesterday that there is now considered to be a postcode lottery in cancer care back again, because we left it in a much better state than that, and so it's a real shame. But that led up to then there was a terrible idea I had. There's a magazine I subscribe to called The Week. And I think it's a brilliant magazine. I've been a subscriber for 20 years. I decided to do a healthcare version of it. And so it purely focused on health and healthcare. And I was launching a magazine into what was becoming increasingly a digital world. And that was a bit of a disaster. But at the launch, which we did at a big conference in Birmingham, a psychologist came onto our stand. I wasn't interested in the magazine at all, but he was interested in finding a web agency that could build him a patient management system for this new psychological therapies pilot the NHS was running. And so we ended up having a few meetings and got a contract to build this thing. And the rest is history, really. What he described was something very simple. He literally drew it on the back of an envelope on our stand. And I said, that's about a £20,000 project. You'll laugh now, okay? But it was, what he described he wanted was probably about 20,000. We then had the first meeting where he kind of put a bit more meat on the bones. And I said, that sounded more like a £40,000 project now. So they put £40,000 aside, and the goalpost kept moving. He kept on adding more and more to the spec. By the time we got to £40,000, we were nowhere near finished. So they went to £80,000 in the end, and we got to £80,000, and this project was still nowhere near finished, and things were being added to it all the time. And then the trust basically said, we can't afford any more. And we were so into this, with this half-finished product, I had to make a decision about whether we were going to commit the company's money to finish it off, and made that, and that was the big call, really. That was the big risk. I decided that I would do it. It was a massive gamble because we had no idea if this psychological therapy service was going to take off or whether our software would be accepted or not. We were doing something quite different to normal patient management systems. So I gambled, and by the time we launched version 1, we spent £250,000 on iaptus. And we had a competition, and so our system went live in London in this trust, and then immediately there was a contract for 12 of these systems went out, and we lost it to our main competitor, which was a disaster because we literally was sitting on £250,000 investment, and the first 12 services went to our competitor. Number 13, or 14, because we had the first pilot, number 14, which was Dorset, Bournemouth and Poole, they decided to do a proper tender, and they compared the two systems and decided that ours was better, so they went with us. That then enabled Wirral to look again at us properly, because they were about to go with our competitor. Wirral decided to look at both systems, and they went with us. And from that moment onwards, everybody was running tender exercises, and virtually everybody was choosing iaptus over our competitor. So we had this really, really scary start, but then it turned out okay. And the decade between 2010 and 2020 was just this period of rapid growth where the company shot right through the 12 people that I thought Mayden was going to be, and and ended up close to 150 by the end of the decade. And iaptus, of course, which you will be aware of, went into children's mental health services. We got 70% of psychological therapies in adults. We went into Australia, we went into Canada, we went into Ireland, but we also went into other clinical services. So we've now done cardiovascular disease prevention, we've done gambling addiction, we've done diabetes remission, we've done neurodiversity is the biggest one at the moment that we're trying to get into because there's a massive problem there, and we really think we can help. But it's one of those services which, unlike the NHS Psychological Therapy Service, where they agreed what the model was nationally and everybody adopted it, which makes things a lot simpler when you're doing IT. Neurodiversities is a bit more of a smorgasbord. There's lots of different types of services around the country, all doing things in different ways. And to design an IT system which suits everybody is, is virtually impossible. Everyone has to compromise. So, yeah.
And going back to that gamble you took.
Yeah.
When the trust said, we can't afford to pay you more than £80,000.
Yeah.
And you decided, okay, we're going to invest, and you reached £250,000 investment in it with the company's money. What exactly, obviously you had your network, I think you had your experience. What exactly pointed you towards making the decision you've made? Because you said you didn't know if it was going to work or not. So what exactly did you look out for? Or did you know, actually, this might just work?
Yeah, I didn't know if it was going to work, to be honest with you. It was a gamble. But we'd half finished this system. And actually, what we'd developed at that point was really good and quite exciting. It's all built around care pathways and outcome measurements. And that was my big thing. I mean, the beauty of this whole thing was that ever since Mayden started, and I was, talking about surfacing data and all the rest of it, it was all to do something called data-driven healthcare, which essentially is about using the data from historical patient records to improve the outcomes for patients in the future. And suddenly I was presented with this opportunity to actually prove that it could work in a service. And because of the way the service was designed, with care pathways and with continuous outcome measurement, there was no other opportunity on the planet that I was aware of that would actually enable us to put this into practice. So for that reason, and for the fact that we were very much committed, and also we thought it had legs. We kind of thought, I think anybody successful in business has to take a risk at some point, and it could fail. and you're obviously trying to minimize the downside of that risk. I didn't borrow anybody else's money to do it. It was in the bank, as it were. I was doing management consultancy still. I can't write a line of web code, by the way, so I was relying on other people to do that. So I would manage the projects, but I was spending my time doing management consultancy, and the fees for that were paying for the web development. So
that's why you had $250,000 in the company.
yeah, so it saved up quite a bit. I mean, we probably didn't have $250,000, but I was still earning fees. So as we were basically burning the cash to develop the system, I was bringing in the money through. And what I was actually working on was the big new hospital development in Birmingham. So there's a big kind of it's architecturally beautiful hospital next to Birmingham University, and I was basically working on the business case for that for about 3 years, and that funding was being diverted into web development pretty much continuously. So
there was a question I was going to ask you about how did you go about funding, but it seems like the fund, you didn't need any fund because you had the money.
Bootstrapped all the way, yeah. So never taken on any investment, never taken on any debt, and I'm getting involved with other startups and companies now. I have done for the last few years, but even more so now, I've stepped back a bit. And it's amazing how much investment and debt people take on when they don't really know what they're doing with it. And they don't know how to manage it properly. And before they know it, they've burnt through all of this cash and they've got nothing to show for it. And it's kind of tragic all around. It's tragic for the investors. It's tragic for the people running businesses. They're just, they might have a good idea, but they just don't have the experience. And I'm also surprised at seasoned investors investing in some of the things that they invest in, because they are, literally gambling, I think. As an investor now, I know you invest in people. So it's not just the idea. You also have to take a view about, is this person going to work hard, and are they capable of delivering what they're promising? And if you don't know that person very well, it's a hard judgment to make. But I guess that's what it's about.
That's a good transition into people, because I want to ask you about how did you go about building the team around you? Because you managed to bootstrap this whole thing. You were the founder. You had the idea. You had the connections. How did you manage to build up the team and sort of like create the culture? How do you go about all of that?
You literally just evolve it and you make it up as you go along. I mean, that's the honest truth. I can sort of retrospectively, I can look at the journey we've been on and I can rationalize it all and say, look, this is all planned. It was all, but that's not how it is in real life. Life and running a business is messy, and actually the people side of it is the messiest bit. So I guess it all comes down to the ethos of what you really believe in about people. And in terms of people that I knew, the best person that I knew of was myself. So I kind of thought, well, what motivates me? What makes me get out of bed in the morning and want to go and do this? And if you can find other people that are like you and feel the same way, you don't need to have all of these carrots and sticks and all the rest of it that businesses use. So you can sort of, do something different. And there's lots of problems with having a typical hierarchical structure that, companies had. I've been working in other organizations that had hierarchies, and there's lots of internal politics. There's lots of backstabbing. There's lots of people hiding information. There's a lot of dampening down the voices of those at the junior levels. And if you think about it, it's really stupid, because you get people like you, Luca, coming out of university, and you want the best people you can find. So you go and get the best graduates, and then in a hierarchy, you just don't let them speak. You don't let them contribute to the extent that they can. And some of these, people are really clever, and they're up to date. They're actually more up to date with the technology than, say, some of the senior people sometimes. So and sometimes they're not. So it's a difficult thing. But what you want to do is create an environment where everybody's voices get heard. And to do that, you have to basically scrap the hierarchy and put something else in place. But, we didn't go to, as you know, Mayden has a flat structure, it has no managers, it has self-managing teams. But we didn't do all of that until 16 years into the company's development. So, but there was an ethos there, like the no blame culture has been there since day one. I think working in a nice environment, not making people come to a crappy office that's leaking or falling down, which is actually what a lot of health service professionals work in. The facilities that they work out of are absolutely awful. I mean, they should have been demolished decades ago, and they're still there, and people still go to work in them every day. They're not at all inspiring. And it's partly why I got involved in the hospital building program when I was doing consultancy, because we were going around replacing a lot of these, pre-war buildings effectively with modern facilities. But yeah, so working out of a nice place has always been important. The no blame culture is always important, and trying to make sure that people are working in an environment where they are almost self-motivated. You don't have to push them to do stuff. They do it because they want to, and that self-motivation, and that's about autonomy and mastery and, all of the things that the received wisdom about, So we kind of explored all of that. And then we just went on a journey where we kind of did our own thing. But I'm really glad we did, because I think we've done something really special. And most of the people who've come to work for Mayden have agreed with that, but it doesn't work for everybody.
That's work for everybody. Still talking about teams and building them. You mentioned something interesting at the beginning. You said, what motivates you? And looking for that. So what motivates you? What motivated you back then? Is it different than now?
So, no, I mean, it's always, for me, it's always what motivates me. It's wanting to make a difference. A lot of people say that. When I was working at the chocolate factory, I was in heaven. I mean, I love chocolate, and I was literally surrounded by it all day, and I could eat as much as I wanted for free. So what makes you leave your perfect job and decide you want to go and do something else? And there was a moment when I left Cadbury's when I realised that this wasn't really fulfilling. It wasn't ticking all my boxes. I didn't feel that I was making a major contribution to society or in enhancing or improving people's lives. And the eventual move into healthcare was a natural thing for me because, I was never cut out to be a doctor or a nurse. And that wasn't me, but I think the caring professions are really important. What I could do was help the doctors and nurses to help the patients. And then, of course, when you're in a company, I just took that one level, sort of 3 times removed, if you like. My job, as I saw it, was to help the staff, to help the clinicians, and to help the patients. And that was kind of how I saw my role. So it's all about people, supporting people, one way or the other, and not to the detriment of any of those. So, for example, you can't, to get everything to balancing acting life, and that's the one thing that I've learned, is you can't focus too much on the clinicians to the detriment of the staff. By giving too much away, you've got to make sure that you're selling stuff at the right price, for example, and that the clinicians are getting good value, because you need to bring that revenue in to basically make sure the staff are paid the right salaries. And you're always juggling these kind of variables. And but similarly, you can't benefit the company and the staff to the detriment of the clinicians and the patients. So you're always trying to sort of manage this thing, and it's quite, it can be quite difficult to do.
I'm also curious about is, because you were just talking about how you enjoyed Cadbury, how you enjoyed obviously the chocolate, like where would you want to live, and then you start to understand that you want to do something more to help improve people's lives, and you realize that the best way for you to do it is to help clinicians that then in turn help the people that are the patients. I guess the question that I have there for you is sort of like a question for me as well. Sometimes I find it hard to fully realize what motivates me,
Yeah.
and it always feels like it's hard to fully see that sometimes. And sometimes I feel like, oh, I haven't figured it out yet. When am I gonna figure it out? Like I feel like I need to figure it out now. How did you feel about like did you feel like that when you were
Yeah, I suppose the one thing I should mention, which was very much a thing, while I was at Cadbury's, my mother died, and she died of cancer, and she all of the information I was getting back didn't sound like she was getting great quality of service. To be honest with you, you know, they misdiagnosed her for quite a long time before they discovered it was cancer. Then, you know, they operated and said it should be fine for at least 5 years after the op, and she wasn't. And it was all just seemed like a bit of a mess. Never really got a clear diagnosis, but she died really rapidly in the end. It was from being first sign of first symptoms to death was only 3 months, so it was really, really quick. As it turned out, when we got into the postcode lottery thing in cancer care, I obviously was very interested to know how the hospital she died in was rated for the cancer that she had, and it was very poorly. And you know, that for me was all the motivation I needed to throw my heart and soul into this project, because there around the country in poorly performing hospitals, there were loads and loads of patients who were getting a bad deal. And you know, and so to have the opportunity to be able to contribute to changing that, I think was really important. I've never been motivated by money. I've always believed that if you're doing the right thing, the money takes care of itself, you know. And I've always found that within Mayden as being true. We've always tried to do the right thing, always try to do the right thing by the clinicians and our customers and the staff. And, you know, we've never gone overdrawn, really. I think there was twice when I had to pay the salaries out of my own money in the early days, but that's only because of a cash flow issue. And it was only when the number of staff was sort of less than 10 or something. So, and that's, you know, you kind of have cash flow is a normal problem when you literally have to pay the salaries, you know, potentially weeks before you get paid by the NHS. It's a problem that all small companies have. So that wasn't an issue. It was all about people. But if I was being completely honest in terms of what it gave for me, I think the thing that turns me on is I do like the positive feedback of being told you've done a good job and what you've done has been valuable to somebody else. You know, and that's the only incentive I really need to kind of keep going, is that somebody appreciates what you're doing. You know, so
absolutely. And I think, as I've said, I spoke with a lot of people before you and I sat down, and I think it was Philippa. I
right.
think it was Philippa or Michelle who I was talking with, and I asked them, "Is there anything you'd like to say to Chris, or is there anything you'd like to ask Chris?" And one of them, I think, said it was sort of like a rhetorical question, maybe, but they wanted to ask you, like, do you realize how much good you've done with the products,
Mm-hmm.
but obviously iaptus is the main one, with the product we have, because it's absolutely impressive. It's been going for 25 years. For the past, since 2010, we've had iaptus, and it's just helped loads of people.
Yeah, and I do realise, but only just. And it's interesting, is it? When you're running a business, you're always looking at the day-to-day problems and the future. You're never looking back to see the journey you've been on. And it's only as I kind of stepped back recently that I looked at the whole 25-year journey that Mayden's been on and thought, yeah, actually, that was good. Yeah, we have done some really good stuff. And just as importantly, we haven't done much bad stuff. You know, the ratio of good to bad is, you know, 95 to 5. It's and that's by everybody. You know, we haven't I think generally speaking, we've definitely had an impact on patients. All the stats show that. We've definitely had an impact on the clinicians. We get nothing but positive feedback generally from our customers, which is, when I started this, or when we started this, it was unheard of in the NHS. Everyone hated NHS IT with a passion, and it's nice to know in the clinical system usability surveys that have taken place, starting in 2016, that iaptus is right at the top. Every time, the clinicians who use it rate it higher. I remember the first one, which was 2016. It was they looked at 140 clinical systems in the NHS, and iaptus was top for system usability because people just loved using it. And that is just the best validation for what you're doing that you can have, really.
I bet. And also, you've mentioned something very interesting in that sentence. You've also stepped back.
Yeah.
So, 25 years, you've been at the forefront of Mayden, and just recently you've stepped back. One of the questions I wanted to ask you about was, how was that transition like, and how was it to give way to step down from the role of CEO and go and do something else, and sort of like trust effectively the team that you've hired and you've built over 25 years, and you picked by looking at what motivates you and the sort of like the differentiators we have, no blame culture, trying to make a difference in people's lives. So how was that?
Yeah, so there's actually a number of questions in that one question.
Yeah.
So let's pick them off. I think first of all, I did. There's an executive consultant who sort of operates around Bath, who wanted to trial something with me a few years ago, and it was a new system that he developed. So I was developing, and he wanted me to be a bit of a guinea pig. And what he asked me to do was to bring 6 pictures along to a meeting of things that I was proud of or successes that I've had, etc. He wanted me to talk about each picture for 20 minutes while he made loads of notes. And then I disappeared for half an hour or so. And then he brought me back into the room, and we had a sort of mop-up session where he basically told me the insights that he'd got from this conversation. So I trotted along, and I obviously didn't just have pictures about work, but work was in there. Mayden was in there. I think a novel that I'd written was in there. My family was in there, etc. There was 6 of them. I talked about this, and I thought, I'm not going to learn anything new, because actually I do a lot of self-analysis all the time. I think I know myself. And I kind of thought I knew everything about myself that there was to know, but there wasn't. He pointed out something which I hadn't really realised, and what he said to me, it was the first thing he said actually when we sat down after the interview, was, Chris, what you do is you don't lead from the front, you create the environment for other people to be able to thrive. And you don't just do it at work, but you do it in the family as well. So I'd been talking to him about how I would rent a villa, and I would just invite all my family to join me, all my kids and grandchildren, whatever. And when they got there, there was no agenda. They could turn up when they wanted, they could go when they wanted, and every single day they could do whatever they wanted. And that's exactly what happened. People just came, we were all together in one space, but everyone just did their own thing, whatever they wanted to do. And he pointed out that in every single picture that I talked about, I was doing the same thing. I was creating the space, as I think it was the phrase he used it. And I realised that's what I did at Mayden. That's how I operated. I was not the big commander-in-chief sitting on top of this hierarchy, basically, initiating a command and control type environment. That's not how it worked. What I was doing was trying to create the environment within Mayden to allow other people to basically pick up, take the initiative, be responsible, be accountable, and basically work to their strengths, but hopefully for the better good of the company and what we were trying to achieve. All I had to do was make sure that the mission was clear, what we were trying to do, and everyone else could work out for themselves what they needed to do to be able to help the company achieve that mission. And I passionately believe if you get that right, it works like a dream. Now, a little side issue, there are people who don't get that and they're in it for themselves. So yes, given all of that freedom, they will do whatever it is to benefit themselves and not necessarily the company or their colleagues or clinicians or patients or whatever. But generally speaking, most people will kind of jump on that and they'll do the right thing, by their colleagues and by our customers. What I found in all of that was that when you say, how did I kind of step back and trust I was already trusting people all the time. So I had a fantastic directors team that I absolutely trusted implicitly. I knew, and I did do this, I went off to Australia to look after our Australian business for, a couple of months at a time. And I knew that the UK company was in good hands. In fact, the running joke was, I think the last time I did it, which was over summer, I came back and we just had our best ever quarter ever, and I wasn't even in the country. So, it wasn't down to me. And then, of course, I ended up getting really distracted by the transaction. So when we finally decided to get investment in, and I was taken out of the business, really. So I think even before you arrived, I was not involved day to day with the staff, to the extent I was before, because it took probably the best part of 2 years to get to the finish line with the transaction. I was spending all of my time talking to investors and to lawyers and to corporate finance people, etc., etc., while you lot basically ran the company and did your thing. So I was already really comfortable with that kind of stepping back and leaving the company, because that was the company I'd set up, and then on all the occasions that I'd already stepped back and did something else, the company was running absolutely fine without me. So I knew it was in good hands. What I then had to do, when I was kind of stepping back more formally, was to make sure that I replaced me with people I thought were just as good or better. Better actually. We needed people who were better. So my role, because I was actually the de facto CEO and finance director, which was an absolutely impossible role in a company the size of Mayden, to do what were two full-time jobs myself was just crazy. And the one big mistake I made was not getting a finance director in a lot sooner, particularly before the transaction. Because during that 2 years, I was doing 16-hour days and working weekends, and nobody was aware of that because I was off the board, basically doing all this behind the scenes. And it almost killed me. So, anybody listening to this podcast and thinking about, selling the business, make sure that you're teamed up to do it. So the first thing we did, we got an FD in, and was really happy with the person we got. And I'm pleased to see that, he's gone down really well with the rest of the company, and, he's very popular. He's got a great sense of humour for a finance director. And then obviously the CEO was the next really big important, and we interviewed a lot of CEOs, and yeah, they just weren't a good cultural fit at all, most of them. And then Reece came along and instantly was the best cultural fit out of everybody. He was absolutely fascinated by a flat structure and self-managing teams and all the rest of it. And it just said all the right things, and it was just a meeting of minds. And and by that time, I'd interviewed enough people to know what bad looked like, or not so good looked like, or, or not quite right looked like. So, so I was really pleased. So when I did finally step back, leaving, the new CEO and the new CFO kind of running the show, I was very comfortable, as comfortable as I could be, that it was going to be okay.
I'm just curious at this point, because you're looking for, you're holding interviews with different people to fill the position of a CEO.
Yeah.
And you're saying that they weren't meeting the cultural sort of like part. I would assume, well, probably quite stupidly at this point, that if you're at that level of a CEO, you've got so much experience, and I'm sort of like wrongly maybe assuming that they won the job, so they would know about the culture. So
Oh, they did. In fact, actually, they came well prepared. I would say at least half the people interviewed had read the book,
So-
Made Without Managers.
what did they fail on then? Like what exactly specific culturally were they? Because if you know the information, you can play to that. So what exactly were they failing?
They didn't get it. So they would literally come in and say, well, I've read the book, I just don't get this at all. It was so alien to them in terms of the way they'd run previous businesses. And let's be honest, lots of people don't get it. They think it's fascinating, but you know, when you're a seasoned executive and you've been around the block a few times, you develop a playbook. And so do investors. They have a playbook as well, and it works for them. So they just literally submit the business that they're running to the playbook that they've learned. And people kind of, you know, have learned different lessons in previous roles, and they may major on those things. But yeah, Mayden culturally is way outside the playbook of most people's experience, and it showed. And you know, you only need to, you know, you don't only to have an interview with somebody who doesn't talk about the people at all, you know, for an hour. It just doesn't mention it. It's all about revenue and profit and margins and, you know, ratios and all the rest of it, which is fine. But you're not going to talk about the people at all, then, you know, and how you manage people and etc. You've got to, you know, your toolbox is half empty, in my opinion. You've got to do the whole lot together, and you know, a lot of people were failing on that.
And the book you mentioned, that's Made Without Managers.
Yeah, Made Without Managers.
Yeah, I'll put a picture up.
The international bestseller.
Yeah, it's.
Yeah.
You worked on. It wasn't just you who wrote the book. It was
Oh no! I mean,
other people as well.
the ironic thing was that actually you got a flat structure, and then the founder just writes a book. It doesn't really send out the right messages. So yeah, there's a whole bunch of people contributed to the book and wrote chapters, which is exactly how it should be. I wrote a couple of chapters, and lots of other people wrote chapters, and yeah, and it got the runner-up prize in the Business Book Awards in 2023, I think it was, 2 years ago. So yeah, which was a big surprise, and we're really pleased. And lots of people have read it, and it's gone down well. And it's really challenged people that it is possible to run a business in a very different way and be successful, because, you know, Mayden's in a minority. You know, I mean, there's less than 1% of companies doing what we're doing. So, or trying anything outside the norm. So, yeah.
And looking at, obviously, you've mentioned that we've talked about the transition. We've talked about picking the next CEO. I guess what I'm also curious about is, where do you see the future of Mayden for like the next 5 to 10 years? And let me give some context to that, because you've earlier said that we already have 70% of the market for with iaptus, and we're trying to go into neurodiversity, gambling, and other addictions. So where do you think we'll go in the next 5 to 10 years? What do you think will happen?
I mean, it's actually quite difficult to predict. I would love to believe that the overall direction of travel is in data-driven healthcare. So, as you know, I've just written a book on that too, which I've just published, and that effectively is me hanging over my legacy and saying, look, this is what Mayden's supposed to be about. This is what we're supposed to be doing. This was the vision and the dream. And if you're doing this, I'm happy. But you know, you're going to have this book staring at you every day. You're not doing it. The reality is, and I get this and I've done it. So don't even think for a moment that the new directors are doing anything different to what I've done. Is you have to chase the money. You might not agree with where the government and the NHS are placing their funding, and what their priorities are. And there's been often that I've really disagreed with the way they've gone about spending the NHS's money. I think it's very short term. They talk incessantly about prevention over treatment. If we can prevent more problems, then we don't need to treat them, but that's a longer term agenda. But the money never goes in that direction. It always goes towards treatment. Generally, it always goes towards hospitals and not the community or mental health. And that's been going on for decades. So it's not just, and this government's saying exactly the same thing. Their three priorities are prevention over treatment, moving into the community, and digitisation of the NHS. Those are the three main priorities. Is that where the money will go? We'll see. But based on my experience of being in working in this sector for 35 years, that's not where the money's gone at all. And it's not been spent wisely. So, coming back to your question, which I've forgotten.
Where do you think the company will go?
Oh yeah, where's it going?
And to be very specific, what I'm also wondering is, in terms of, we used to say, we used to have this phrase of going wider, deeper, or further.
Yeah.
Where do you think we should go?
So I've always thought wider. So out of those three, deeper's got to be the priority, because you need to hang on to the customers you've got. We've got some fantastic customers who've been with us, longer than most of the staff have been in post, and they have been really loyal, and we must do right by them. And mental health is still a huge problem. It's not getting any better, and all the studies and the analyses and everything are showing that our mental health problems are just as bad as they've always been, and that psychological therapies works, and that's the main thing. It's been study after study is showing that actually that what we're contributing to is doing a lot of good for people. And it's staggering what the volume is. I mean, iaptus takes on more than 1 million new patients every year. And we're now over 10 million patients in our database. That's a fifth of the population. It's crazy when you think about the numbers. So we definitely need to double down on that. And I think a lot of the things we're doing already are going to be helping that service become more and more effective and efficient over time. So that's number one priority. And then out of the wider versus deeper, I think I've always favoured going wider into other clinical areas. That's tougher because you've got a system which is quite focused now on mental health, and you try and take it into another clinical area, doesn't quite fit, and so you're having to develop the software to try and make it fit as best you can, and that's really difficult. It's where most software things go wrong. Further, in some ways would be ideal, because you just take your mental health system and you just sell it to mental health services all over the world, and that would be great. But when the reality of trying to do that is very, very difficult, as we found, or different as we found. So yes, we're in Australia and we've got customers all along the eastern seaboard, but not many. And breaking into that market has been really tough. Canada, we're finding really tough. America, we're looking at, and we're looking at it and thinking that's tough even before we've tried to get into the States. And so I just think that all those markets on paper, they look the obvious places to go. The reality is they're just much tougher to get into. So, and we know the NHS, we're able, we know the people, and even within, services which are adjacent to psychological therapies, there's usually quite a lot of commonality. We can get to know the people and much easier, I think, than trying to go into different countries. Ultimately, though, I'd like to be doing both. It's just that I would focus on wider. Of course, the funding has to back that up. There's no point in trying to chase a underserved service in the UK if the government aren't going to fund that service. And we've definitely had that problem in the past. So we've take an example now. Neurodiversity has got waiting lists that are years long, for both autism and ADHD. And so we know that's a real problem, that we know we can help with that. And we know our software it's very good at processing huge numbers of volume, huge volumes of patients, and and getting them through. It's very, very efficient to use, and we're making it more and more efficient, for all sorts of clinical services. However, are the government going to throw money at those neurodiversity waiting lists? Don't know. So you're kind of saying, well, we see the need, so we're going to basically, but we don't know if that money is going to follow, or is it actually now going to go back into cancer services because we've suddenly discovered that we're the poor man of Europe again in terms of cancer outcomes, which is effectively what the news was yesterday. So the NHS is struggling on all levels at the moment. It really is. And, but digitisation has got to be part of the solution. Everybody recognises that a lot of our health services are very inefficient. And, if we can go digital a bit more, we can do so much more and save huge amounts of money and treat a lot more patients and get much better outcomes. We can do all of those things. But, we just need a focus, and short-term thinking doesn't provide that. If you're going to focus on prevention rather than treatment, which I absolutely think we should be doing, then you've got to back it up with the funding. But that's not going to win you the next election, because the benefits of preventing diseases you won't see for years, and potentially even decades.
Yeah.
So.
Looking, so this has all been quite fascinating, to be honest. The story and sort of like the transition and sort of like the future a bit. Let's reflect for a bit. Looking back at when iaptus really took off. If you were to go back in time and like start that all over again, whether it's the moment iaptus took off, or whether it's back in 2000 when you were looking into the cancer, what would be your number one priority, knowing what you know now? Like, what would you do that?
Yeah, so I always say my biggest mistake was allowing the system to become less flexible than it should be. And whenever I say that, people disagree with me, because they say, well, if you'd had insisted that we did this development while maintaining the flexibility to take the software in all these different directions, we would have lost this contract, and we would have lost this contract, and we would have lost this contract. And the history has shown that those contracts were critical to the growth of the company. But the more that we took short-term decisions to win contracts and basically wrote quick software that did the job, but reduced the flexibility of the system to be able to go into places like diabetes remission and cardiovascular disease prevention in a way that maybe it could have done better if we try and kept the whole thing more flexible. Maybe we'd be in a better position now. And it's impossible to know whether, but I always say, I know our software is not as flexible as we'd all like it to be. I know that as soon as a new clinical service comes along and says, well, we want it to do this and that, we would all think, well, the decisions we made years ago, which means it's actually quite difficult to change it now. So I think, well, my answer to that question is, because everything's great in hindsight, is that I wished I'd insisted on maximising the flexibility of the system as it got developed. But as I say, there are people who will point to loads and loads of examples where we were working to very tight deadlines, and if we weren't able to meet those deadlines, we wouldn't have got the contract, and then the money wouldn't have come in that actually would have funded the development, because you can't fund that sort of thing with fresh air. You've got to have the income coming in to be able to keep developing the product and making it better. I just wish we'd been able to keep the flexibility. Whether it was a bad decision or not, that's for others to decide.
That's a fair enough answer. And looking back at your sort of like journey from a business perspective, you've obviously filled a lot of roles, and toward a couple of minutes ago you said that the biggest ones were obviously the role of the finance and the role of...
It became more I've always taken a very simplistic view of finance, but sorry, I didn't.
That's
finish
absolutely
your
okay.
question.
I'm wondering if there's, in the creation of Mayden and then building and to where it is now, is there anything along this journey that you can look back and say, I've done this thing and I know it worked, and if I'm going to start a company again, or if I'm going to be involved in an investment, I'm going to take that thing I did that worked and try to transition it or implement it here?
There's lots of little decisions that I've made that I think have had huge benefits. I mean, one of the genius things I did was,
I said humble at the beginning.
yeah, you did say humble, but this was a stroke of genius. We had I mean, it's a very minor thing, but a year ago we won a Southwest Business Award for Innovation, and I did the presentation, and I went through all of these things that we were innovative about, because they were really interested in what ways have we been innovative. But I remember giving this example I'm about to give you, and the panel was just like, they all looked at me and thought, wow, that is really smart, and why haven't we thought of that? And you could see that they were, they're in the same sector, so they were suffering the same issues. It's a really, really simple thing. But we had a problem where our financial year runs from April to March. And we would get to March and the customers would all have deadlines at the end of March, because, the NHS runs from April to March as well. So in March, we would find ourselves running around like headless chickens, trying to meet all of these customer deadlines. But there were two major problems. One is all the customers were using up their annual leave, so we couldn't get hold of them. They were trying to put pressure on us to deliver, but they disappeared, because they not used all their annual leave that year, and they just weren't available to contact. Likewise, the staff were also trying to use up their annual leave, because our annual leave year was April to March, and so our staff were all trying to take time off while also hitting all these customer deadlines at year end. So I suddenly thought, this is absolutely crazy. So I switched the holiday year to be from October to September. And suddenly people are having to use up their annual leave in August and September, which is the end of the holiday, which is when they want to go on holiday, because they don't even want to go on holiday in March when they're having to use up their annual leave. And it meant that everyone was available to hit all these deadlines in March. And it was such an obvious thing to do. But do you know how many companies have got a different financial year and holiday year to suit their business environment? Virtually none. And a lot of people may listen to this and think that is so obvious. And, hopefully we'll switch our annual leave year to be much more consistent with how their seasonal cycle runs, because there is definitely one in healthcare, and with the last quarter usually being the busiest. It's not always true, but throughout 25 years of running Mayden, our January to March has always been the busiest and actually brought in the most income. And yet that's when we were trying to get everybody to use up their holiday. Bit stupid, really, but, So that's but there are lots of little things like that I would say, yeah, that was a good idea. And particularly around the cultural stuff, the no blame culture, I think, has been absolutely the best thing to do, because people make mistakes, and generally when they make mistakes, they try and hide those mistakes. I mean, we see it on the news every day, people trying to hide mistakes, and they just dig themselves deeper and deeper into a hole. At Mayden, we ask people to say, if you've made a mistake, own up to it as quickly as possible so we can sort it, and there will be no blame. Yeah, we will all learn the lessons collectively, and we'll put in whatever systems, processes we need to make sure it doesn't happen again. We've done that from day one, and it has been transforming, because we've had some real howlers, and if people had not owned up to them, we would have been in serious trouble. But because people felt it was a safe space, and they did, we managed to sort out the problem, and and everyone's been happy, and everyone has appreciated the no blame environment, that we actually genuinely meant what we said.
Yeah, and it sounds scary, but actually it's it's quite, number one, I think, because I work here, right? And I feel like it's liberating to like own up to a mistake. Number one, it makes you more honest. Number two, and number three, it sort of like builds that relationship with the team you have.
Yeah.
And they understand, and you then work together to help fix the issue or face the problem that might have been created. Yeah. No, it's
And also it helps
nice.
people be a bit more innovative, because, you know, being innovative is, you know, kind of risk taking. And there's probably people listening to will thank me for what I'm about to say, but there's one, the biggest thing that happened, it was years ago, it was about 20, it wasn't 20 years, probably 15 years or so ago. Somebody decided to be innovative and use a new software tool that we hadn't used before. And it was this software tool was going to help with some of the development processes. I can't even remember what it was for, you know, what it was to do. But it accidentally, or, you know, it had a bug in it basically, ended up deleting an entire customer database. And, you know, literally all disappeared. And the service that we're using it, well, I'm going to tell you which service it was, you know, suddenly they were all there treating their patients, adding their notes to the system, everything went, the whole lot. And obviously went into a panic. But the person who did it admitted it straight away, said, look, this is what happened. I was using this tool and it's just gone and deleted the entire database. We had backups, and the backups were up to date. And literally within 4 hours, we had that service back up and running again as if nothing had happened. Now, that person who accidentally deleted the database could have said nothing. You know, we wouldn't have known what had happened. You know, there would have been nothing to say. You know, they could have just literally just gone home and hoped that, you know, nobody would have noticed. But the fact that they owned up immediately meant we were able to do something about it immediately. And everybody rallied around. You know, it's amazing, and you will have witnessed this. When something goes wrong, everyone runs towards a problem. They don't run away from it. And that's what, you know, in this environment, that's what you need. You know, it's so important.
Yeah, every single time it happens, you're right. I see it, and it's quite fascinating. Okay, so I think we've got 15 more minutes.
Yeah.
And we've got some questions that are specifically for you.
Yeah.
So something I'm also interested in is, how do you sort of like process issues? So whether that's a business issue, whether that's a finance issue, whether that is a life issue, how do you look at them? How do you sort of like process them from understanding it, breaking it down, finding a solution?
So it's nice to think that every problem you look at has a solution. You just got to work it out. Like Sudoku, you know, you've got all these numbers in a grid. I generally do Sudoku sort of every day at the moment, just to keep my brain active. But there is only one solution to any starting point. That is not the real world. In fact, there is, you know, most of the problems that we deal with have potentially a number of solutions. And I think recognizing that is really important. So what I tend to do is, my starting point is, okay, what are all the different solutions, and what are the likely benefits and, you know, and the likely outcomes of doing that, and what are the risks involved if we do this rather than this, or rather than this. I don't for 1 minute think that I'm in the best position to answer that question. I will have a view, but other people will have views as well. So the first thing I would do is sound out a lot of people who I believe have something to say into the situation that I'm thinking about. And the great thing about the flat structure is that I don't just go to my fellow directors. You know, I would maybe speak to one of the directors who I think is closest to this issue. I'll probably speak to one of the developers who I think is close to this issue, or on the data people. I would literally kind of try and figure out who is the best person to give me advice on this, and say what they think is the right thing to do. And I would just collect them all, you know, and generally speaking, I would try and get consensus on the solution. I personally prefer to process alone. So having collected all the information, I'm not very good at making decisions on the fly in a room full of people. I like big decisions. I like to just take them away and think about it. And I seem to just analyze better and get a better perspective when I'm not under pressure in a room full of people who are all trying to push in certain directions. So that's kind of partly also, I think, the introvert side of me as well. I mean, there are people who will just, bang on the table and say, we're going to do this, but that's not me. So,
And does that same process apply in your personal life?
yeah, it does. Yeah, I do a lot of processing offline. But if I've got a problem, a personal problem, I will generally find 3 or 4 friends or colleagues who I think would give me good advice on that particular issue. And they won't always be the same 3 or 4. There'll be the 3 or 4 that I think are best to talk about that issue.
I understand.
Yeah.
Obviously, you've taken a step back from Mayden.
Mm-hmm.
So what's your plan for the next 5-10 years? Like, what are the things you're doing now, or what are the things you're hoping to get into?
So I've always wanted to write, as you know.
Yeah.
And so I've never found time when I was working. I mean, I've written 2 novels, and both of them took me 4 years while working full time. And I was writing while using up annual leave and weekends. COVID, for me, lockdown was a godsend, because I had this novel which was, I don't know, 2/3 written, I think, and it'd take me 3 years. And then in literally 2 months in lockdown, I managed to finish it, which just showed what could be achieved. Because I couldn't see anybody, I couldn't go out, and I was literally just stuck at home. So yes, I was working all day, but then apart from doing my hour's walk that I was allowed to do in the initial lockdown, there was nothing else to do. And I thought, I'm not going to waste this opportunity of being locked down, because that's how I saw it. I mean, most people didn't see it as an opportunity, but for me it was. I thought, I'm not going to waste this opportunity. I'm going to get this book written. And now, having proved that actually you can be quite productive, I'm thinking, yeah, well, I'd actually like to write more. So that novel came out last year. I'm actually a third of the way into a sequel.
So you say the novel, is that The Son of a Man?
That's the one. Yeah.
Great book. I read it, and I'll be honest with you, I haven't read sort of like a novel in a while. The books I'm trying to get into right now, the books I've been trying to read are psychology, sales, business, entrepreneurship, biographies.
Okay.
And it was a nice sort of break from them. And I'll be honest with you, I bought, I think, back in November or December, sometimes around then. And I was like, okay, cool. I want to try to read it like as fast as possible, because I thought we were going to sit down much sooner.
Yeah.
And then I found myself picking up the book and starting chapter number 1. I was like, oh my God, it's actually so interesting. And I literally finished it in like 3 or 4 days.
Yeah.
It's the whole premise of it. I'll put the description up. It's so interesting. It's so interesting.
Yeah.
And it's got so much physics in it that kind of like blew my mind. But it also blew my mind the fact that, how much physics do you know? Because like you wrote this thing.
I don't. I'm fascinated by it. So I had this idea. I mean, obviously, I don't want to do any spoilers, but I had this idea back in 2014.
Okay, a while ago.
Yeah, that was when the idea came for about a Messiah figure appearing and sort of second coming, but with a big twist, and I kind of thought, somebody must have had this. This is so obvious. Somebody must have had this idea before. There's nothing new under the sun. And anyway, I did a bit of research, and nobody had done this, and for me, it was just such an obvious story to tell. And then at the same time, I'm really fascinated by quantum physics, and I'm really fascinated by theology, and I've studied both, and they're like completely different worlds, the worldview of quantum physics and the worldview of theology are just really, really different. And I thought, you know what, within this novel and telling this story, I can explore both of these and bring them together, and make them clash in a way, and see what happens. It just basically said, you just got to write this, and because it's everything you're passionate about. And I found this with both the novels I wrote. I have lots of ideas for novels. I'm probably carrying around a dozen in my head at any time. But there's always one idea which leaps out and says, this is the one you have to write next. And so, that it became a compulsion in the end to get this out there. But now I'm into the writing business. It's changing things. So the first thing that happened when that came out, I got a number of requests for a sequel, and I was never going to write a sequel. It was just supposed to be a standalone novel. It's all self-contained. It doesn't need a second book. But so I thought to myself, well, what would I write if I was going to do a sequel? And then I had an idea, and so I'm a third of the way through that idea now. The second thing is because I'm an indie author. I haven't got a publisher as such, and I discovered the only people really making money who are indie authors and are people who've written series. And because what they do, you lose a lot of money when you write a book. It's like making wine. They say the best way to make 100,000 out of wine is to invest 1 million in a vineyard. But they, indie authors, I so feel sorry for them, if they're trying to make a living out of it, because it's really, really difficult. Everybody takes their cut, and the big retailer organizations take so much of the money. Printing costs are high. You can only ever do small batches, so the cost per book is quite high. Then there's all the advertising you have to do, because you have to do all your own marketing, and not surprisingly, you do not make money. I can tell you now that I am spending as much on advertising as I am making in sales. So it's balancing out kind of roughly equally, and and that's loss making, because you don't get all the money from a sale. The retailer does. So, but the people who've written series, they only market the first book in a series. They throw everything at that, and then their return is that people read the first book and then want the second and the third, etc. So it's one author I spoke to a couple of months back who basically has got a 15-book series out, and he only advertises the first book. But his readers will generally go on and read all 15 in the series. And he's making a lot of money on books 2 to 15. He just loses a lot of money on book 1.
So it's going to be The Son of a Man Part 2.
There is going to be a sequel coming out, yeah. And then I think that one of the other things I realised was that the second book is a story, again with a big twist at the end. But I realised that there's an opportunity here to world build. Ironic that we're in the world building sort of institutes or whatever it is in Bath, but I kind of thought, so what I'm doing in the second book is I'm starting to build the world on which other books and stories can follow, which I've started to do in this, but I've kind of taken it up a level in the sequel. So.
I think that's good, because when I was reading it, there were some elements of it which I didn't quite get. I was sort of hoping that they would come again. It would come up again in later chapters, and some of them did. But there's some things I didn't quite get at the beginning.
Right.
So it's quite nice to like build that world, because then things start making more sense.
Yeah, I mean, hopefully I'll pick up you can let me know which things you don't think.
Yeah, absolutely.
Yeah. But I'm definitely building on a lot of stuff in here about the world, and where it's, particularly where the discovery in this book, it's all about a big discovery.
Yeah.
Where that actually takes the world and what happens afterwards. So, and I don't know where it's going to go, but I'm doing it's like a transition novel, really. It almost feels like I'm writing a book that is a stepping stone from where we were there to a new world, and it's like, it's a bit in the middle.
I see. think we've got like 3-4 more minutes.
Okay.
You've already said writing. Is there anything else you're gonna?
Yeah, so writing, obviously, I've been contacted by loads of charities. So people have heard that I'm free, and I'm biding my time with those because they're all worthy causes and they're all doing wonderful things. But I don't want to have my time sucked up by trying to do too much too quickly. And one of the things I listened to a panel of entrepreneurs who sold their businesses before I sold, got investment into Mayden, and they all basically said, don't do anything for a year. Don't commit to anything for a year, because if you jump at the first offers you get, there'll be better ones that come along or things you're more passionate about. So I have carried on supporting the charities that I was supporting before, but I haven't committed vast amounts of time to them, and I'm quite wary of doing that. I'm enjoying the freedom I've got at the moment to do stuff like this. But I'm also starting to invest in smaller businesses, companies that are just out of the startup stage. So they're not startups, they're just getting going, and they've got something that customers clearly like. And so I've made 2 investments so far and got involved in 2 companies, completely different to health tech, and they're taking up some of my time, and but fascinating, brilliant people doing wonderful things, and just a real departure and a change for me.
I see. Well, thank you for that.
Yeah.
I think final question for me is there anyone you're sort of like, is there any piece of content you have recently consumed or you're looking up to or you're always finding interesting that I should go read about?
I mean, I read lots of stuff, and I'm fascinated. Obviously, the big thing at the moment is AI, and you'll probably be as on top of that as I am, if not more. I think the thing that is really fascinating me, and it's slightly linked to the data-driven healthcare bit, is what we're discovering about the biome and its impact on our health. So the gut biome. Something I've been fascinated with for years, but actually more and more I'm finding, as they discover more and more about how, there are now people who believe that almost all chronic disease is linked to your gut. There are people who think that things, there are papers that have just come out that apparently have linked things like Parkinson's and whatever to problems in the gut. They're now exploring whether dementia is linked to gut issues. There's 2 brains. Your gut has a brain, and there's a vagus nerve which is attached to your main brain. And I'm just absolutely fascinated by where this is going to go. So big takeaway is basically to everybody is eat properly, because do your 30 plants a week and all the rest of it, because the science is showing more and more that it actually has a massive impact on your health. But so do other things, exercise and so on. I mean, I'm at an age now where I need to focus on my health more, and it's one of the things I have been doing actually that I wasn't doing when I was in Mayden. I didn't find time for it, but I am now, and that's one of the things I've latched onto.
Well, Chris, thank you so much for this. Really appreciate you giving me the time. And before we get up, I've got something for you. Obviously, you've just mentioned that you want to take care of yourself, but let me just. Oh, right. So this is a closing tradition on the podcast. Right. So this is for you.
Yes.
Chocolate bar.
Excellent.
So this chocolate bar, I think it's the brand is coming from Turkey, I believe, or somewhere.
Turkey. Okay. Yeah.
Or somewhere there.
I've seen it before.
I don't. Please tell me where, because I can't find the United Kingdom unless there is a small shop in Birmingham, I believe. It's like one of those street shops that sell fruit and vegetables.
Yeah.
And they have an online, very junky website, but very good that they have it online. They sell this chocolate bar as well as part of their products.
Yeah.
But apart from that, it's really big in Romania. I can find it anywhere. and it's the best chocolate bar I have ever had.
Okay, I'm looking forward to it now.
Yeah, and the story behind it, just as quick, I'll make it really quick. When I was a kid, I obviously used to have chocolate bars, but I always, every time I would take like a couple of bites, I would think to myself, this doesn't have enough chocolate.
Right.
Until high school, someone introduced me to the chocolate, and ever since then, I've been in love with this. So this will have so much chocolate.
Well, it certainly looks like something I will enjoy eating because it's with dark chocolate, and I've definitely got, because of the biome stuff, I've got more into dark chocolate than milk
nice
chocolate these days.
Perfect.
Which is great. I do like the wafer type things, so I like things like Ferrero Rocher and all the rest of it these days, which is very nice. But I mean, the first place I would look at is online, see whether it's available somewhere on there.
I can send you a link for this one if you do enjoy it.
Yeah, no, please do. And and then the other place, if I was trying to find a shopping bath that sold this, I'd probably go to the International Supermarket.
I've been there.
yeah.
I've been there. They don't have. There's even a Romanian shop.
Oh, really? Yeah.
5 minutes from where I live. I went in there. I go in there every 3-4 months to see if they brought in. I went in last week. Not yet. They have a brand. They have a chocolate from the brand on the shelves, but not the thing. Gonna wait a bit longer, yeah. Tesco allegedly has it, but it's always out of stock.
I know. I mean, the brand does look familiar, but I'm going to look forward to that. I'm currently working my way through a box of Ukrainian chocolates, which somebody gave me at Christmas time. So, and which are absolutely delicious.
I bet. Yeah. Right. Well, Chris, thank you again.
That's all. Good to do this.
Absolutely.
Yeah.